Welcome to SARC Talk. SARC is a nonprofit cancer research organization that develops and manages clinical research trials in pediatric and adult sarcomas. SARC Talk is a podcast to discuss activities of SARC, interview sarcoma research leaders, and review scientific initiatives in the sarcoma field.
Welcome to SARC Talk, episode 17. My name is Scott Okuno, a medical oncologist at Mayo Clinic and Chief Medical Officer at SARC. At SARC Talk, we interview interesting people who are connected to sarcoma, where we can all share and spread the knowledge about sarcoma. All episodes are posted on our website, Spotify, YouTube, and our SARC channel, and wherever podcasts are available. Please subscribe and submit questions because we do look at them and do change content. July is Sarcoma Awareness Month, and we were blessed to have two SARC Research Advocacy Council members here today to share how they got interested in sarcoma and how they presently engage in sarcoma advocacy. Please welcome Valerie Stevenson and Carolyn Dewalt. Valerie is a retired school principal from UC Vancouver and got involved in sarcoma and SARC through her son's diagnosis of desmoplastic small round cell tumor. Carolyn Dewalt is a retired elementary school administrator and survivor of GIST and is a life group advocacy and engagement specialist. Welcome, Val and Carolyn.
Thank you.
Thank you.
Excited to be here.
Thank you. Val and Carolyn, you and I had the pleasure of meeting in Los Angeles during our RAC meeting, or the Rochester, Research Advocacy Council for SARC this couple of months ago. Maybe you can share with our audience a little bit about yourself and how you got involved with what we would call the Research Advocacy Council. Val, we'll start with you.
Okay, well, and nice to be speaking with you, Dr. Okuno. Last November, my son was diagnosed with an ultra-rare sarcoma, desmoplastic small round cell tumor, which is a bit of a mouthful, so we'll just call it DSRCT for short. I started researching and looking for information on it and came across the SARC Talk podcast. I have to tell you, I was immediately comforted by your soothing voice, Dr. Okuno. So I listened to all of the podcasts and was really impressed with the topics, the guests, the moderator. And it just seemed like there was a genuine motivation to connect with the audience. And I found that the scientific information was presented in such a way that it was somewhat easy to understand. There was a message to reach out with questions, and so I did, and was surprised to receive a prompt reply and an invitation to connect further with the organization as part of the Research Advocacy Council. So here I am.
You know, it's quite interesting how that simple finding information, looking through various feeds, and you found us. So that is really exciting. And you did highlight that there's very little information regarding desmoplastic small round cell tumor, and that's part of the reason why you engaged. Carolyn has a little different story, and maybe we can hear your story, Carolyn, and then we can then have further input.
Sure. Yes, mine is a little different because I am a sarcoma patient. 7 years ago, I was diagnosed with GIST, gastrointestinal stromal tumor, which is the, of all the sarcomas, it is the most diagnosed. So it's rare, but it's not so rare, but it really is rare. But I was fortunate in that when I went to the doctor and said, I don't feel well, I don't know what's wrong, within a few weeks, I got the diagnosis because for many of us, it doesn't happen that quickly. So now, soon after that, I found LifeRaft, the organization that was developed to support those of us with GIST, and I have been a volunteer for that organization almost the full 7 years since I found them, because they do such wonderful work that I became a volunteer out of appreciation. And having worked closely as a mentor and now as the advocacy and engagement specialist. I've talked to a lot of new members, and I've often say there's nothing that Life Raft won't do for you. And I do mean that because that's just how good we are. And when Life Raft said, "Would you like to consider joining SARC on the RAC committee?" It didn't take me long to say, well, yes, I need to do that. Because I see my experience talking to all these members as a benefit, not only to SARC, but to Life Raft, but being part of RAC is a great benefit to Life Raft. It gets me involved in the sarcoma uh, group as a whole, and so hopefully it's a win-win. So hopefully I have things to share, and I'm going to learn from you all so that I can help Life Raft.
Well, the good part is both of you have come to SARC and our Research Advocacy Council from two different realms. One as a caregiver, parent, with a rare diagnosis of her son, versus someone who is a survivor of a more common sarcoma and comes from a very well-organized advocacy group, and in fact is engaged in an advocacy group as well. So part of what we're trying to do at SARC is to bring a lot of the different voices that we have here to our organization as well and learn from you. So it's not to reinvent the wheel or do things that you guys do well, but to see that there are gaps. And we'll get later on in our discussion today is that there are gaps that we see in the sarcoma community. And part of that is how we and share with the audience today of how that comes about. Carolyn, you did share a little bit with us Life Raft, and many of us do know about Life Raft, but maybe you can just share a little bit more about what Life Raft is, how the organization was set up, and then what is that specific program or specialist that you're called an advocacy and engagement specialist. So maybe share with you a little bit about Life Raft, a little bit more, and go with that role. I'm going to look it up again, so go ahead.
Well, back in 2000, and prior to 2000, people with GIST pretty much were told to go home and get ready to, get their affairs in order. But there was a awesome clinical trial that began around that time for a drug called Gleevec, which has been called a magic bullet in the world of targeted drugs. And there were several gentlemen who had family members with GIST that were in this trial, and they got together in a basement, and they pretty much built the Life Raft group. And so by 2002, they were up and running. They had a newsletter, and here we were. The Life Raft group was afloat, if you will. And Life Raft is committed to enhancing the survival and the quality of life for people with GIST. And they do this through patient-powered research. We have the world's largest database for GIST information in our patient registry. They use education. There's always something going on. If nothing else, go on the website and watch a video. We have many ways to educate our people. We have monthly support groups, webinars. We empower our members. We provide the knowledge and the feeling that yes, I can advocate for myself. And finally, a Life Raft also has a global outreach because we are international. Sarcoma is not just in the United States, it's everywhere. And there are plenty of countries that don't have the type of care that we do. And so we reach out and we do our very best to help them. Because remember, there's nothing that Life Raft won't do for their members. But really, I guess in short, the vision of the Life Raft group is to empower a future fueled by data, guiding our journey toward cures for all rare diseases. So we're not just we focus on GIST, but we realize that there are other rare diseases out there, and LifeRaft has actually mentored some other groups to get organizations started for those types of cancers as well, or diseases for that matter. As far as the my title, I actually started doing my job, if you will, as a volunteer long before I even had a title. And so the job sort of developed the title, but I call every new member in the United States and Canada that joined the Life Raft. So in the past year and a half, I've talked to about 300 people who have joined our organization, and it I get as much out of it as I hope those individuals do. It gives me a purpose for having cancer, and I can tell that the reaction that I get when I say, "Hey, I've got just two," is you can just hear, you see them breathing out and realizing that, oh my gosh, I'm talking to somebody that knows what's happening to me. So, and I get built up all the time, and I'm trying to build up everyone else too. So, yes, very much enjoy doing that.
No, Caroline, that's a great way in that Life Raft started, how it developed, and how it continues to have a patient-facing focus, and having a human touch with somebody with experience with the disease, knowledge of the disease, and compassion about the disease is huge. And I think part of the success of any organization is that part. We also have to go back and say this started in the basement of two gentlemen. And as more and more we hear about founder stories of these patient advocacy groups, it's not big groups telling them what to do. It's small people with great ideas, developing resources and building it out. So we're really excited for what Life Raft has done and what you continue to do. And you bring some of that knowledge to us as we continue to build out. And you know what it takes to contact 300 plus people. That's a lot of people.
Especially when they live in Hawaii, and I'm on the East Coast. But anyway.
Exactly. You know, we work through time zones too. And as you said, you're a global organization, because I know Canada has a chapter and other groups in Europe as well, and in all of the world. So it's great.
Yeah.
Val, your experience is a little bit different. I know there was frustration when you were trying to find information regarding a rare type of sarcoma like desmoplastic small round cell tumor, where there is no patient advocacy group or coordinated effort. We do have what we would say pan-histology agnostic patient advocacy groups that don't really align with any specific type of cancer or type of sarcoma, their sarcoma support. And then we heard a lot about Life Raft. We heard in the past and previous podcasts, we have the EHE group and other groups that are very histology specific. And there's values to both of them. So maybe you can share, Val, a little bit about the frustration of trying to find it. And we did hear how Life Raft just started with two people in the basement. So kind of share a little bit with our audience, our group here, about the frustrations and how you're thinking about patient advocacy group and how we can support rare, what we would call ultra rare tumors. Val?
Yeah, so, my experience has been quite contrary to Carolyn's with Life Raft. And when I'm listening to her describe it, I'm like, oh, well, maybe Life Raft would like to take on an ultra rare sarcoma under its umbrella. There is some information on different sarcoma groups about the rare sarcomas. But to be honest, when I Googled DSRCT, which is the first thing you do when you get a cancer diagnosis, let's be real, that's what patients are doing. There was little information even on the sarcoma sites. We have a Facebook group for DSRCT. And although it provides support in many ways, it's challenging and frustrating trying to gather pertinent and accurate information following threads on Facebook. So it's either been going to Facebook for info or finding rather complex scientific articles online
that really do exceed the skill set of the average person. And it's just, sometimes I feel like I've been like a forensic scientist trying to delve into these articles. And that's really not, understanding a sophisticated topic like oncology is challenging. So at this time, there is no group for this ultra rare cancer, and it is very challenging. And I am somewhat envious of the other groups out there like EHE and LifeRAF, where it's well organized, and it's a challenge to look at how we can do this. And on the Facebook group, there have been a couple of people that have, appealed to starting something, but again, that is challenging as people are fighting disease or caregiving and all of that. So,
no, Val, thanks for sharing your experience and with the ultra rare tumors. And we don't want to have anybody have any cancer, and it's sometimes nice to align with a very common cancer. And if you think common, it would be like lung cancer, breast cancer, where there might be a lot of notoriety, a lot of exposure, a lot of people wearing pink, as you might imagine, or other things. But, July is Sarcoma Awareness Month, so we have to kind of continue to promote that. But part of what we have to say in our organization at SARC is we need to engage with the well-resourced, knowledgeable, expert opinion type of data like LifeRAF has versus unconsumable threads within Facebook and Twitter, let's just say. So part of that is to help figure that out. And when we vet in Los Angeles and other advocacy meetings, I learned from both of you. I learned from all the Research Advocacy Council members because of the struggles that are so diverse, because we think it's all one and the same. It is not. It is totally different. And that helps us do that. And part of what we do at SARC is we want to develop trials in sarcomas, both the more common ones and maybe the ultra rare ones. So we do look for support from advocacy group to encourage enrollment in those studies. We will look for support financially for some of these studies to do the correlative work here as well. And we do love the idea of engaged members as we design the clinical trials. The good part is we're in a growth spurt now that we're going to start to develop and build protocols from concepts that are ready to launch. And then that's when we're going to engage our Research Advocacy Council to ensure that the data we're collecting, the design of the study, what we're expecting patients and caregivers to do on the study is appropriate. Because we as researchers think that, we want everything, but there are some limitations and expertise that you all have as family member, caregivers, as well as patients who've actually gone that journey to say is what really would it take to do that. So as we start to think about how the Research Advocacy Council can engage with us, maybe tell us some thoughts of how we at SARC can engage with advocacy groups better, and how do you think that can help the community as a whole? Maybe we'll start with Carolyn, because you have the wealth of resources and experiences in an advocacy group already. Carolyn?
I do see this from both sides as a sarcoma patient myself and as being involved with an advocacy agency. And the more that we can get together and collaborate on efforts would just be a plus for everyone. Sometimes I think that we tend to duplicate things, and if we got together and worked on things that perhaps it would be easier. I know that SARC has a registry of sarcoma centers. LifeRaft has a registry of sarcoma specialists. So it could be that in some way those two agencies could mesh those two together and make even a stronger opportunity for patients. Sometimes just sitting down and brainstorming ways. I mean, we did a lot of that when we met in January, and I think some positive things came out of that. You never know what somebody's going to say or what idea is going to come up, and you can say, "Hey, that's a good idea." So the more we can do, actually have conversations and face. There's nothing like face to face, and I know that in this post-COVID world, that Zoom is wonderful, but it's just not the same as sitting around a table.
Yep, sitting around a table, maybe throwing a round ball down 10 pins, So those are, you learn a lot about each other in different venues. But you're right. I think having that conversation with organizations is important, and representation, because it helps inform us what we do. SARC has worked hard and is engaging more and more with the Sarcoma Coalition, which is the group of patient advocacy groups that deal with sarcoma. Some are fully vetted, well-run organizations. Some are well-run organizations that are just getting their feet wet, trying to move forward through the system there. And I think what you're saying is we need to continue the dialogue of what the needs are going to be. But that is exactly correct. Val, any additional thoughts on?
Yeah. Kind of piggybacking on what Carolyn said earlier, I think because sarcomas are so rare, trials and studies need to be made available to everybody, all ages, everywhere, all places. There are too few cases of sarcomas in comparison to other cancers. And from my observation, it seems like a big part of being a physician and healing today, and especially if you're working in the field of rare disease, is being able to provide support so that people have access no matter where they live, no matter what they do. And the impact, I've been thinking about it, the impacts of rare disease are widespread. I mean, can affect finances, access, everyday responsibilities, and mental health too. So you might have started off with a physical health issue, and now all of a sudden you've got anxiety on top of it. It just compounds when it's something that is very rare. And, for patients to be treated or to have access to opportunities where they live, and know that their primary oncologist can access the support and expertise of people that are specializing in the disease, who are often in big centers, and build that therapeutic alliance so that they don't need to be in a certain place to access the study or the trial. And I'm not sure how the whole billing system works, but if a physician needs to email or spend time communicating with a patient's physician in a small town or whatever, maybe there needs to be a way to support that, and that there's an organized way for that to happen, not just, I'll reach out to so and so. It really does need to happen. So those are just some of the thoughts that I've got on studies and trials. And
So what you're sharing, Val, is the importance of accessibility of our clinical trials and our expertise across a very large geographical area. And many of us promote ourselves as experts in the field, and we'll get into that in a second here. And part of what we're trying to do is understand at SARC sarcoma centers, and that's our sarcoma registry. And what Caroline said too is that we at our meeting in January said, well, certain groups have additional expertise of certain histology specific experts. We will allow that to occur in that space. Because for us, we have say that in general, we have sarcoma centers of excellence that have high volume. And then you all have these very niche histology specific expertise where people have much more research interest, clinical expertise that you guys keep a separate list. So that's how we built it out. And We would love to have one all the same, but that's very hard to do. So we say this is the main one, and if you have a GIST one, we'll reference GIST. If it's an EHE, we'll reference that as we move forward. So we do appreciate that, and as we engage, we have to make sure that all people have access to studies. Now that becomes finances, et cetera, but that's something we'll continue to work on. We do know that many organizations, many medical institutions are really working on advocacy, making sure patients' voices and family voices are heard, and it's still work in progress. Please maybe share a little bit of what you think are still the opportunities of engagement, because we all say we have patient advocacy groups. We all say we have representation, but where do you see the gap in saying we have it versus actually engaging with the group? Maybe we'll start with Caroline.
Well, I often say a newly diagnosed sarcoma patient, whether it be GIST or any of the others, they don't know what they don't know. We don't. We follow the lead of the doctor blindly, and too often we go down the wrong road because the doctor is not a sarcoma doctor. We're not at a sarcoma center, but I didn't know I needed that. So there's getting the word out to these newly diagnosed patients that you need that specialist. So you've got your registry, and hopefully that when someone is diagnosed, they're going to go to that registry and find the right place to go. But as I said, you don't know what you don't know, and you often get off on the wrong foot. And too many doctors don't admit that this isn't really something that I know. Let me find you someone who does know GIST. I do think the medical centers are, the large ones particularly, they are having survivorship programs start up. This is new in the last couple of years. They are doing their best to meet the needs of the whole patient. And I talk to that to my new members about, your oncologist is going to treat your GIST, but there are other doctors, there are other services, there are other programs within your medical facility that are going to help you with everything else. And as Val mentioned, there's a mental health issue, there's financial, there are a lot of things going on. And in the case of Life Raft, we try to help with all of those, but sometimes there's only so much you can do. We would like to do more, and we certainly are trying, but I do see the medical facilities doing a better job. I just wish that the doctors that didn't know GIST would say, I don't know GIST, and send people to another doctor. So if you can fix that, we'd be good.
Well, you bring up, we're smiling if you're just listening, and the reality is, where in a sarcoma journey should a patient engage with a high volume sarcoma center? We say the answer is yes, they should engage somehow. And Val kind of said, well, how does that look? Well, we have a sarcoma tumor board at SARC that if you're a community, you can present a case and get expert opinions from our SARC tumor board. There are multiple other specialists in the region that can get to it, but you're right. As a patient, you don't know what you don't know.
Scott, if I could jump in there, I just completely concur with what Carolyn said, and you just reiterated, you don't know what you don't know. And as a patient, that's where you start from. And yeah, we do want the doctors to say, I don't know about this. And you need to go to where they do know about it. That is what we do need that. And I'm speaking from an international perspective. As someone who lives outside the US, it's even more challenging. What I've come to learn, in the sarcoma world is that, with these rare sarcomas, the expertise is often situated in the US. And because of the small number of people who are affected, it needs to be worldwide, not just US specific, Europe specific, or Asia. disease is not neatly divided up into geographical areas bounded by political borders. And that's really frustrating, I think, when we come to, these rare sarcomas. It's a barrier to access. Maybe it's an opportunity for medicine to bring the world together. Like this, I don't know, World Health Organization or how it can be done, but it looks really different when you're outside the US. And it shouldn't be like that. We need worldwide therapeutic alliances.
Well, you're starting to think about where we are today. Caroline kind of said too, is that we're a lot better than we were in the past, but there's a gaps, and I think you both shared some of the gaps that we in the sarcoma community will continue to work on and try to close that gap.
Yeah, and I think that the tumor board that SARC has is fabulous because I know it, anybody from around the world can access that. And so that's a great starting point.
But then you don't know it's there. I mean, the people that need it don't often know that it exists. So educating the patient about services.
So here's your opportunity, and you're right. We need to get the word out. Fortunately, Caroline, you're making calls to every single person who signs up on the registry. Okay, we don't have that resource within SARC, but since July is Sarcoma Awareness Month, and if you had a billboard that we can post everywhere that everybody would see, what would you put on that billboard? Caroline, we'll start with you.
When I knew this question was coming, and the first thing that came to my mind was Yogi Bear. And what I would say is sarcoma is not your average cancer, and it cannot be treated by an average doctor. And then I would put July 13th is just Awareness Day.
Well, that's great. So that's the billboard that my vision is going to see.
Yep.
Yogi Bear with that thing, and that's very interesting. So, Val, what would your billboard look like?
Yeah, I like that, Carolyn. I think that's awesome. So maybe that could be the first tagline. And then the other thing that I've been really noticing, feeling strongly about is sarcomas are rare, but many of them affect young people disproportionately. And DSRCT affects young men. And so I would put that. I guess sarcomas are rare. Many of them affect young people. And children are well looked after, but the adolescent and young adult population is a population that I think needs to be targeted. And Carolyn said something earlier in the podcast, which I've thought about a lot, because many people will spend almost up to 8 months getting a diagnosis. And often young people are treated by physios and sports medicine doctors and maybe even counselors or whatever until they get their diagnosis. And Carolyn was able to go to her primary physician and say that she was feeling unwell. And maybe feeling unwell is good enough to get an investigation into something. So I know that sounds like a lot of words for a billboard, but I think going back to Carolyn's about you can't be treated by just your average oncologist when it comes to a rare sarcoma, and also that many of them, that they're rare and they affect young people.
Very good. Well, I reached in my box those that are visually here on YouTube. This here is an organization that I belong to. It's called Rain in Sarcoma. And we talk about the 6 red flags, and I know that this was done in Britain as well. Anything bigger than a golf ball, and this is a golf ball hanging on here, is an awareness. So I know I would be remiss if I don't talk about Rain in Sarcoma, and a lot of the efforts that a lot of you all are doing is early detection, when should physio be concerned, and a lot of educational experts on that, and to get the word out that this does affect young people in the prime of their life, and how do we get them to the right people at the right time. So I do appreciate you guys both being here. And as we close, any follow-up messages that you might have for our audience?
Well, I think I'd like to say, Carolyn mentioned that they have the largest database with GIST. I'm kind of on the opposite end of that. I'm still looking for the DSRCT database. I haven't been able to find it. I feel like it would be useful in knowing who's been treated, where they've been treated. What you see online is that, there's very few cases. I think there's probably more cases than what we realize. I'm convinced it exists, and it would be helpful to be able to access something like a database. So that's a question I have. And I guess when it comes to our health, we shouldn't have to rely on Facebook and GoFundMe healthcare.
Well, I have the opportunity just to respond to that. Not the last part, but the first part is at our ASCO SARC meeting, we actually had a speaker there talking about desmoplastic small round cell tumor and the data and that. So you're right. And Cheppy Conrad, the board of our director, is working on major cancer centers to get to the granularity of histology, Val. So we do encourage people and organizations that are willing to help support that effort, because it's going to take some time and effort to get that, because that is going to be important. So we do agree. Caroline?
Mine's pretty quick. Get a second opinion. You're not hurting anybody's feelings. You're not stepping on anybody's toes. You deserve a second opinion. I don't even care if you think you have a specialist, go ask somebody else. If they both say the same thing, wonderful. But second opinions, very important.
Great messages. I might have to have 2 or 3 billboards now, but that's okay. We can deal with that. So we do appreciate it. So thank you, Val and Carolyn, for sharing yourselves. A little bit about the efforts that you are doing. We appreciate the time and effort that you shared with us at SARC and this podcast. And we really appreciate the expertise and unique perspectives that you bring to our organization and organizations that you're going to impact. So we do appreciate that. And just remember, now July 13th will be Sarcoma Awareness Month. But remember, sarcoma happens all year round, and we need to continue to do that. So that is great.
Exactly. Yes. Well, thank you. I've certainly enjoyed sharing my knowledge, and I hope that someone will benefit from both of us talking to you.
And again, thank you so much, Scott, for having us on and allowing us to share our different perspectives on.
I learned even more today than we did when we were in Los Angeles. So we look forward to our next face-to-face meeting and to learn more from each other. And for those that are listening or those that are seeing us on YouTube, we look forward to our next podcast, which would be then SARC episode 18. Until then, keep sarcoma in your mind and be aware. So thank you all.
Thank you for listening. Be sure to subscribe so you never miss an episode of SARC Talk. To find out more about SARC, please visit our website at sarctrials.org. To suggest a topic or for questions, please email us at sarctalk@sarctrials.org. The SARC Talk series is made possible due to funding from Boehringer Ingelheim. Together, we can find a cure for all forms of sarcoma.